Cardiac surgeon warns. This drug is damaging the hearts of older adults. As Dr. Michael Kent, a cardiac surgeon with over 2 decades of experience, I am compelled to unveil a truth that may profoundly shock you concerning substances that might currently reside innocuously within your bathroom cabinet, yet subtly and insidiously compromise the most vital organ in your entire body. During my extensive career, I have borne witness to countless cases where individuals, previously considered in perfect health, arrived at my operating room with hearts tragically scarred, not by conventional disease or genetic predispositions, but by seemingly benign medications they had implicitly trusted. These aren't obscure, experimental compounds or highly specialized prescriptions. Rather, I speak of the commonplace pain reliever you may have reached for this very morning to alleviate a persistent headache, the stomach-soothing pill swallowed with your breakfast, or even the familiar cold medicine you unthinkingly grabbed from the pharmacy aisle just last week. What I am about to disclose directly contradicts the prevailing narrative and conventional wisdom you've been conditioned to accept regarding the purported safety of these widely used pharmaceuticals. The colossal pharmaceutical corporations, with their vested interests, naturally have no desire for this information to reach the public, and regrettably, the vast majority of medical practitioners remain unaware of this critical, often devastating physiological connection because they simply haven't had the unique vantage point that 20 years in cardiac surgery affords. However, I have observed this grim pattern firsthand. Patient after patient, heart after heart succumbing to avoidable damage, and my professional conscience dictates that I can no longer remain silent. By the conclusion of this comprehensive discussion, you will possess an unequivocal understanding of precisely which 5 categories of medications are clandestinely eroding the strength and vitality of your heart muscle, decipher why their inherent dangers become particularly pronounced and magnified after the age of 60, and most crucially, be empowered with actionable strategies you can implement starting today to proactively safeguard your cardiovascular well-being. This is not an exercise in fear-mongering. It is an urgent dissemination of life-saving truth, a commitment to informed health decisions. I urge you to remain attentive, for the knowledge you are about to acquire truly possesses the potential to significantly extend your healthy lifespan. Let us commence our exploration with a class of medications so ubiquitous they can be found in virtually every household across America. The non-steroidal anti-inflammatory drugs, universally known by their acronym NSAIDs. You recognize them instantly by brand names such as ibuprofen, naproxen, and diclofenac. They are your immediate go-to recourse for relieving persistent headaches, alleviating nagging back pain, mitigating the discomfort of arthritis, and generally addressing various forms of bodily discomfort. Undeniably, their efficacy in pain and inflammation reduction is remarkable, and their therapeutic benefits are not in question. However, here lies the critical caveat that is rarely articulated with sufficient gravity. Regular consumption of these pills beyond the age of 60, especially if you carry any pre-existing cardiovascular concerns or risk factors, is tantamount to engaging in a perilous game of Russian roulette with the very integrity of your cardiovascular system. The deeper echelons of the medical community have, in fact, been cognizant of this unsettling truth, this dark secret, for many decades. As far back as 2005, the United States Food and Drug Administration, FDA, issued an unequivocal mandate compelling pharmaceutical manufacturers to affix prominent and explicit warnings regarding the elevated risks of heart attack and stroke associated with these medications directly onto their packaging. Yet, astonishingly, millions of individuals continue to ingest them on a daily basis, often with the casualness of consuming confectionery, utterly oblivious to the insidious danger potentially lurking within each tablet. Consider the poignant case of Michael, a vibrant 72-year-old gentleman whose greatest joy in life was meticulously tending to his expansive rose bushes in his garden. He grappled with chronic knee arthritis, a condition for which he routinely took naproxen almost every single day to manage the persistent pain. One fateful afternoon, while engrossed in his beloved gardening, he was suddenly overcome by an overwhelming sense of exhaustion, an inexplicable fatigue that left him completely drained. He found himself struggling desperately to catch his breath, his chest tightening with alarming regularity, and his ankles had visibly swollen to more than twice their normal circumference, a disturbing manifestation of fluid retention. Upon his urgent arrival at the emergency room, our diagnostic assessment revealed a grim reality. He was experiencing an acute episode of heart failure, his heart already laboring under the typical stresses of age, and an underlying, albeit mild hypertension simply could no longer sustain its vital pumping function. The direct precipitating factor was not a newly developed cardiac condition, but rather the cumulative and continuous use of that seemingly innocuous anti-inflammatory pill. How, one might reasonably inquire, can something so universally accessible and commonly employed harbor such deadly potential? The underlying physiological mechanism is truly insidious in its complexity. NSAIDs function by blocking specific enzymes, primarily cyclooxygenase (COX) enzymes, which are instrumental in reducing inflammation and pain pathways. However, in achieving this targeted effect, they concurrently interfere with the intricate balance of other vital substances within the body, particularly those that are crucial for safeguarding kidney function and maintaining the healthy integrity of your blood vessels. This dual interference precipitates two catastrophic effects on the cardiovascular system. Firstly, NSAIDs compel your body to retain an excess of salt and water. To visualize this impact, imagine your heart as an incredibly sophisticated and hard-working pump. If, quite suddenly, there is a vastly increased volume of fluid coursing through the circulatory pipes, that pump is immediately forced to operate at its absolute maximum capacity under immense strain. While a young, robust heart might possess the inherent resilience to momentarily withstand such an acute surge in workload, an older heart, already contending with the age-related stiffening of its muscular walls or valiantly battling against chronic high blood pressure, can precipitously fail under this exacerbated stress, just as Michael's did. Secondly, these medications possess the inherent capacity to constrict your blood vessels, leading to a significant elevation in blood pressure. Even if an individual has no pre-existing history of hypertension, regular and prolonged use of NSAIDs can induce a notable and clinically significant rise in their blood pressure. Furthermore, for those already diligent in managing their hypertension with prescribed medications, NSAIDs can astonishingly nullify their therapeutic efficacy, causing blood pressure to spiral uncontrollably upwards without any immediate perceptible symptoms. It is absolutely critical to grasp that the magnitude of this cardiovascular risk is directly correlated with both the dose and the duration of NSAID usage. Particularly, drugs like diclofenac and high-dose ibuprofen, typically around 2,400 milligrams daily, are most strongly and consistently associated with adverse cardiac events. While low-dose naproxen appears to present a somewhat safer profile, it is imperative to acknowledge that the risk is never truly zero. And here is yet another revelation that often comes as a profound shock. If you are diligently taking a low-dose aspirin regimen specifically to protect your heart against cardiovascular events, certain NSAIDs, most notably ibuprofen, can regrettably neutralize that invaluable protective effect entirely, rendering your aspirin regimen ineffective. So, what course of action should one undertake in light of these serious implications? The unequivocal solution is not to passively endure debilitating pain, but rather to initiate an honest, comprehensive dialogue with your primary care physician or cardiologist. Pose the direct question, "Doctor, given my unique medical history, my age, and my current health profile, what is genuinely the safest and most appropriate pain relief option for me?" A myriad of effective alternatives exist. In many instances, acetaminophen proves perfectly sufficient for pain management. Other times, localized anti-inflammatory creams or gels, which exert their therapeutic effect topically without significant systemic absorption, present excellent and safer choices. For cases where an NSAID is deemed absolutely indispensable, the overarching golden rule must be rigorously adhered to. Employ the lowest effective dose for the shortest duration possible under strict medical supervision. Our journey through potentially heart-harming medications now brings us to number 4 on our list, a category that will undoubtedly elicit considerable surprise, primarily because it is widely marketed and commonly perceived as a protector of gastric health. Proton pump inhibitors, or PPIs. We speak of medications such as omeprazole, pantoprazole, and lansoprazole, which stand among the most frequently prescribed drugs globally. Millions of individuals routinely incorporate them into their morning regimen, almost as an established ritual, either to manage chronic acid reflux disease or to safeguard their stomach lining from the potential erosive effects of other medications, such as the very NSAIDs we just extensively discussed. And herein lies a profound and bitter irony. The very medication, prescribed with the intention of shielding you from one specific health risk, may, paradoxically, be creating another, equally insidious danger through an entirely unforeseen pathway. Allow me to illustrate this with the story of Helen, a 68-year-old woman who was initially prescribed omeprazole for her persistent and debilitating chronic reflux. She was explicitly instructed to take this medication indefinitely for the rest of her life. True to its promise, her acid reflux symptoms vanished entirely, and she, understandably, never questioned the long-term implications. Years later, during a routine and otherwise unremarkable medical checkup, her electrocardiogram, ECG, displayed an unusual and concerning pattern. Subsequent blood work conclusively revealed the underlying cause. Her magnesium levels had plummeted to a dangerously low point. Magnesium, often referred to as the guardian of your heart's rhythm, plays an absolutely crucial role in maintaining electrical stability within the cardiac muscle. When this essential electrolyte is severely depleted, your heart's intricate electrical system becomes inherently unstable, akin to an orchestra suddenly bereft of its conductor, leading to the emergence of potentially life-threatening arrhythmias. The undeniable cause of Helen's severe magnesium deficiency was traced directly to her chronic and prolonged omeprazole use. PPIs meticulously reduce the production of stomach acid, but it is precisely this natural gastric acidity that is fundamentally crucial for the efficient absorption of a wide array of essential nutrients from your diet. When this acidity is suppressed over an extended period, the body's capacity for magnesium absorption collapses dramatically. Yet, the concerns extend beyond mere nutrient malabsorption. There exists another, perhaps even more unsettling association that deeply concerns us in the medical community. Numerous large-scale observational studies have consistently identified a compelling link between chronic PPI use and an elevated risk of heart attack. One prominent theoretical explanation posits that these medications might inadvertently reduce the systemic levels of nitric oxide, a crucial signaling molecule indispensable for maintaining the flexibility and expansiveness of your blood vessels. When nitric oxide levels are diminished, blood vessels can lose their elasticity and stiffen, thereby setting a perilous stage for the onset of a heart attack. While the precise causal relationship remains a subject of ongoing scientific debate and rigorous investigation, The recurring statistical association is undeniably a cause for profound concern. Furthermore, omeprazole can detrimentally interact with other vital cardiovascular medications, such as clopidogrel, a potent antiplatelet drug routinely administered to patients following heart attacks or strokes to prevent subsequent thrombotic events. This interaction can render clopidogrel significantly less effective, thereby leaving the patient alarmingly vulnerable to further cardiovascular complications. The core issue lies in the unfortunate trivialization of these powerful drugs. They were originally conceived and developed for short-term therapeutic interventions, typically spanning 4 to 8 weeks, yet they have regrettably transitioned into a perceived permanent solution for chronic ailments that, in many cases, could be more effectively managed through diligent lifestyle modifications. If you have been routinely taking a PPI for several months or even years, it is paramount that you do not abruptly discontinue its use on your own, as this can trigger a rebound effect of severe acid production. Instead, engage in an urgent and comprehensive discussion with your physician. Ask directly, do I genuinely require this medication for the long term? Is it feasible to gradually reduce the dosage under supervision? Are there alternative strategies or treatments we can explore? And if chronic PPI therapy is deemed absolutely necessary, it becomes essential for your physician to regularly monitor your magnesium levels through periodic blood tests. Before we delve into the next crucial categories of medications, which notably include some remedies for even the most common of ailments, such as a simple cold, I wish to make a brief but heartfelt request. If the information you have absorbed thus far resonates with you as valuable and potentially life-altering, I humbly ask for 2 straightforward actions. Firstly, please consider subscribing to this channel. My singular mission is to consistently deliver clear, unequivocal, and straightforward health information, stripped of jargon and complexity, empowering you to make the most informed and beneficial decisions regarding your personal well-being. Secondly, and perhaps even more profoundly important, I urge you to share this video widely. Take a moment to reflect on your beloved parents, your cherished grandparents, or your dearest friends. A single, simple click can initiate a transformative conversation that possesses the genuine capacity to save a life, to avert a health crisis. Your support in disseminating this critical knowledge is invaluable, and for that I extend my deepest gratitude. Let us now proceed to uncover the risks associated with number 3, a common fixture in almost every household: oral decongestants intended for relief from colds and flu symptoms. We are specifically addressing those formulations containing pseudoephedrine or phenylephrine, widely lauded as the magic solution for that exasperatingly stuffy nose that stubbornly refuses to clear. However, this seemingly miraculous solution can, for your heart, exact an extremely high and potentially devastating cost, particularly if you already contend with pre-existing high blood pressure or any other form of cardiovascular disease. Take, for instance, the case of Margaret, a 75-year-old retired teacher who contracted a particularly severe cold. In her earnest desire to breathe more comfortably, she purchased a well-known over-the-counter cold remedy containing pseudoephedrine from her local pharmacy. By the second day of its use, she experienced a terrifying sensation that her heart was literally going to burst from her chest, accompanied by an overwhelming wave of dizziness and a throbbing, splitting headache. Her concerned son immediately rushed her to the hospital. Upon arrival, her blood pressure was dangerously elevated, surging through the roof, and she had developed a pronounced cardiac arrhythmia. That seemingly harmless decongestant had pushed her delicate cardiovascular system precariously close to the brink of collapse. Why does this alarming phenomenon occur? Pseudoephedrine and phenylephrine are pharmacologically classified as vasoconstrictors. Their fundamental physiological function is to narrow blood vessels. Within the nasal passages, this effect is undeniably beneficial, as it effectively reduces swelling and congestion, thereby facilitating easier breathing. However, the crucial point often overlooked is that the drug does not act exclusively within your nose. Once ingested, it circulates throughout your entire body, systematically constricting blood vessels everywhere. This widespread vasoconstriction has two grave consequences. Firstly, by constricting arteries, your heart is compelled to pump against significantly greater resistance. Metaphorically, it is akin to attempting to force water through a garden hose that has been severely squeezed. The internal pressure within the system explodes. This can trigger an acutely dangerous spike in blood pressure. Secondly, these substances are powerful stimulants. They incite your heart to beat at an accelerated rate and, critically, often with an irregular rhythm. If an individual already possesses a sensitive or compromised heart, this additional stimulation can profoundly destabilize its normal function, leading to serious complications. Disturbingly, recent investigations by European regulatory agencies have renewed a focused attention on pseudoephedrine due to its documented association with rare but profoundly serious syndromes involving the constriction of blood vessels within the delicate structures of the brain. This concerning finding unequivocally underscores the widespread and powerful systemic effects of this drug throughout the entire body. The paramount danger associated with these medications stems from their pervasive availability over the counter. People purchase them without diligently scrutinizing the fine print on the labels and, more critically, without a comprehensive understanding of the inherent risks involved. If you are over the age of 60, and especially if you suffer from hypertension or any pre-existing heart condition, it is imperative to avoid these oral decongestants completely. There exist numerous and significantly safer alternatives. Simple saline nasal sprays, the use of humidifiers to moisten nasal passages, or nasal sprays containing corticosteroids that exert their action only locally within the nose are all excellent and safer choices. Do not allow temporary relief for a stuffy nose to become a life-threatening emergency for your precious heart. Our diligent exploration now brings us to number 2 on our list, a delicate but profoundly vital topic: mental health. Specifically, I refer to an older class of antidepressants that, while less commonly, are still sometimes prescribed for cases of clinical depression, and in other instances, for the management of chronic neuropathic pain. These are the tricyclic antidepressants, known by names such as amitriptyline or imipramine. It is important to acknowledge that depression itself constitutes an independent risk factor for the development of heart disease, which underscores the undeniable criticality of treating it effectively. However, the method by which we treat depression matters enormously, and these specific drugs can pose significant dangers to the aging heart of an older individual. Consider the illustrative case of Frank, a 78-year-old gentleman who endured excruciating pain in his feet due to severe diabetes-related neuropathy. His physician, aiming to alleviate his suffering, prescribed a low dose of amitriptyline. While the medication did indeed help to mitigate his pain, Frank soon began experiencing debilitating dizziness every time he attempted to stand up from a sitting or lying position. One day, this dizziness became so severe that he fainted unexpectedly, resulting in a fractured hip, a common and devastating injury in older adults. The direct cause of this fall was attributed to the amitriptyline, which had triggered a sudden and pronounced drop in blood pressure upon standing, a condition medically termed orthostatic hypotension. However, this is not the sole cardiovascular risk associated with tricyclic antidepressants. These powerful drugs can also significantly accelerate the resting heart rate, which translates into constant undue stress on an already aging and potentially compromised heart. Most concerningly, tricyclics possess the capacity to interfere with the heart's intricate electrical system, often slowing down the vital electrical impulses that regulate its rhythm. This manifests as observable changes on electrocardiograms and, more gravely, significantly increases the risk of developing very dangerous ventricular arrhythmias, irregular heartbeats originating in the lower chambers of the heart that can tragically culminate in sudden cardiac death. For all these compelling reasons, tricyclic antidepressants are unequivocally no longer considered the first-line therapeutic choice for managing depression in older adults. Today, clinicians overwhelmingly favor newer classes of antidepressants that possess a much safer cardiovascular profile. Nevertheless, tricyclics are still occasionally prescribed for the specialized treatment of neuropathic pain, which is why awareness remains paramount. If you or a beloved family member is currently taking one of these medications, it is absolutely fundamental to initiate an in-depth conversation with your doctor. Inquire directly. Have safer alternative treatments been thoroughly explored for my condition? Is my blood pressure and heart rhythm being meticulously monitored given this medication's known effects? It is a fundamental truth that mental and physical health are inextricably intertwined, operating hand in hand. You must ensure that the treatment intended for one aspect of your health is not inadvertently causing harm to another. And now, we arrive at the final medication on our list, number 1. This particular point is perhaps the most controversial and widely debated within the scientific community, yet it remains my solemn duty as a cardiac surgeon to share the legitimate and growing concern that pervades medical discourse. I am referring, incredibly, to calcium supplements. Yes, you heard that correctly. Those seemingly innocuous pills that millions of individuals dutifully ingest every single day with the intention of protecting their bones from the ravages of osteoporosis. For many decades, the public health message surrounding calcium was crystal clear and unwavering. Take calcium for strong bones. This directive was ingrained into collective consciousness. However, in recent years, an increasing volume of rigorous studies has begun to seriously question the long-term cardiovascular safety of these supplements. Allow me to introduce you to Linda, a 70-year-old woman. Driven by a proactive concern about developing osteoporosis, she independently began taking a high-dose calcium supplement without consulting her physician. Years later, she tragically suffered a heart attack. What made her case particularly perplexing was the absence of classic cardiovascular risk factors. She was a non-smoker, and her cholesterol levels and blood pressure were consistently within healthy parameters. In the meticulous investigation of possible causal factors, her medical team ultimately focused on that daily calcium supplement. The controversy surrounding calcium supplements and heart health is undeniably real, and it is crucial to acknowledge that the scientific evidence is not yet definitively conclusive, exhibiting some conflicting findings across various studies. Nevertheless, the leading hypothesis deeply concerns us. Calcium obtained naturally from dietary sources, such as dairy products or leafy green vegetables, does not appear to present a problem. This is because dietary calcium is absorbed slowly and incrementally, allowing the body to efficiently utilize it for bone health without creating sudden surges. The issue, it appears, arises with the concentrated, high doses delivered by calcium supplements in pill form. When you ingest a calcium pill, it creates an artificial and rapid spike of calcium in your bloodstream. Your body, despite its needs, often cannot efficiently utilize or incorporate all of this suddenly available calcium into your bones, and consequently, the excess has nowhere else to go but to deposit in other tissues. The primary and most significant concern is that this excess calcium preferentially deposits in the walls of your arteries. This insidious process, known as arterial calcification, leads to the arteries becoming rigid and inflexible, thereby contributing significantly to the formation and exacerbation of the atherosclerotic plaques that are the underlying cause of heart attacks and strokes. Indeed, some large-scale epidemiological studies have suggested that calcium supplements are modestly associated with an increased risk of heart attack, while other studies, it must be noted, have not detected this specific connection, underscoring the complexity of the research. For individuals with a medically diagnosed case of severe osteoporosis, the documented benefits of calcium supplementation for bone density might, in certain cases, outweigh these potential cardiovascular risks, a decision always made in consultation with a physician. But the overarching lesson here is crystal clear. When it comes to calcium, more is emphatically not necessarily better and can, in fact, be detrimental. The safest and most physiologically appropriate strategy for obtaining calcium is consistently through a balanced and nutrient-rich diet. If your doctor, after a thorough evaluation, genuinely believes you require a calcium supplement, it is absolutely imperative that you never initiate taking it on your own accord. This must be a carefully considered medical decision, one that meticulously weighs your individual bone health requirements against, and very importantly, your specific cardiovascular risk profile. Today, we have collectively unveiled the often hidden, perilous side of 5 remarkably common types of medications: anti-inflammatories, gastric acid protectors, PPIs, oral decongestants, certain older antidepressants, tricyclics, and surprisingly, calcium supplements. My paramount message to you today is not one of panic or alarm, nor is it an instruction to abruptly cease taking any of your prescribed medications. Doing so independently, without direct medical supervision, could, in fact, be exceedingly dangerous and lead to severe adverse health outcomes. My message is, fundamentally, one of profound empowerment. You are now equipped with invaluable, life-protecting information that the majority of the population unknowingly overlooks. You now possess the critical awareness that the very pill you take for arthritis pain could be dangerously overloading your heart. You understand that your trusted stomach protector might be subtly, yet significantly, affecting your heart's delicate electrical rhythm. You are now cognizant that a simple, over-the-counter cold remedy could pose a serious and unexpected risk to your cardiovascular system. Utilize this newfound knowledge to transform yourself into an active, informed, and proactive partner in managing your own health journey. The next occasion you visit your doctor, arrive thoroughly prepared. Compile a comprehensive list of every single medication you are currently taking, meticulously including all over-the-counter remedies, herbal supplements, and vitamins. Then, engage your physician with clear, targeted questions. Doctor, I've recently learned that this specific medication could potentially carry certain risks for my heart. Given my unique medical profile and age, is this still unequivocally the best and safest option for me? Are there any safer alternatives that we could explore together? Should we implement any specific monitoring, such as regular blood pressure checks or periodic specialized tests, to safeguard my heart? Every single medical treatment, without exception, represents a delicate balance between its anticipated benefits and its inherent risks. Crucially, that balance shifts and evolves significantly with age, as your body's physiology changes. Your heart has tirelessly performed its life-sustaining work for many decades, beating millions upon millions of times without pause. It profoundly deserves the most exquisite and vigilant care you can possibly afford it. Actively protecting its health and vitality is unequivocally the single best, most impactful investment you can make in the quality and longevity of your future. Never take any medication for granted, regardless of how common, familiar, or ostensibly harmless it may initially appear. And now I ask one final crucial thing of you. I encourage you to share your thoughts and experiences in the comments section below. Did any of the information presented here genuinely surprise you? Your personal stories, your insights, and your questions possess the immense power to enlighten and assist countless others who may be facing similar dilemmas or harboring similar concerns. And above all, please remember this fundamental truth. Always engage in a comprehensive dialogue with your doctor. That informed conversation, that collaborative discussion, is indisputably the most important and protective step you can take today to ensure the robust health of your heart for all your tomorrows. Take exceptional care of yourself and your precious heart.